Welcome to episode 12 of our weekly video podcast. Today, we're explaining everything you need to know about the palliative care services we offer at Medicarehub Limited. Stay tuned and enjoy.
All right, so today we're going to be doing a deep dive into palliative care in the UK. And we're going to be focusing on information we got from Medicarehub Limited.
Sounds good.
Now imagine, like you or someone you love is dealing with a really serious illness. It's not just the medical stuff, is it? It's like all the emotional and practical things, even spiritual challenges can just feel like impossible to deal with. And that's where palliative care can really help, right?
Yeah, absolutely. And it's really important to remember that palliative care, it's not just about end-of-life care. It's about improving someone's quality of life at any point during a serious illness. So it's really this whole person approach. It works alongside any other treatments they might be getting.
So it's not about giving up. It's about living the best you can for as long as you can.
Exactly. And Medicarehub, which is a big provider of these services in the UK, they really stress that in their materials.
Yeah, definitely. And speaking of Medicarehub, it seems like they really put the patient in the driver's seat. They talk a lot about patient autonomy, which is all about giving people the power to make choices about their own care.
You're right. They're really part of this movement towards patient-centered healthcare, where it's not just the doctor telling you what to do, but it's a real partnership.
Yeah, and it's more than just an idea. They actually have stories on their website. There's this one about a guy named John who had a chronic illness and was feeling totally lost. But through Medicarehub, he was able to get help with not only managing his pain, but also with counseling and even just daily stuff like cooking and cleaning. And it sounds like it made a huge difference in his life.
Yeah, that's a great example of how Medicarehub takes those big ideas about holistic care and actually puts them into practice. They're addressing physical needs, emotional, social, even spiritual. And they don't forget about families either. They offer a lot of support for family members because they realize this isn't just an individual journey.
Yeah, it really does take a village, right? And when you look at all the services they offer, it's really impressive. Symptom management, emotional support, help with daily tasks, even respite care for family members. It's like a complete package of support.
It is, but we should mention that there are, other palliative care providers in the UK too. They have different models and approaches, so it's a pretty diverse landscape out there.
Right, so Medicarehub might not be the only option, but they're definitely a major player.
Definitely. And one thing that really stands out about them is how they take these ideas about palliative care, which can sometimes feel a bit abstract, and they turn them into real practical services. It's not just talk, they're actually doing it.
That's really important. So we've talked about how they define palliative care, but I'm curious, is there evidence that this approach really works?
That's where it gets really interesting. There's actually a growing amount of research showing that palliative care can lead to a better quality of life. Patients are more satisfied, and it can even reduce hospital admissions.
Reduce hospital admissions. Now that's something everyone can get behind. It sounds like palliative care isn't just about feeling better. It could actually make the whole healthcare system work better.
Exactly, and that brings us to the financial side of things. Medicarehub doesn't talk about cost a whole lot in their materials, but the research shows that good palliative care can save the healthcare system money overall.
So it's not just about individual well-being. It's about using resources wisely, like looking at the bigger picture.
Right. By providing the right support at the right time, we can potentially reduce the need for expensive hospital stays and interventions down the line.
Well, that's a pretty strong argument for making palliative care a standard part of our healthcare system.
Yeah, it is. And Medicarehub is a great example of how that can work. They have this multidisciplinary approach, which means they have doctors, nurses, social workers, and other specialists all working together, so patients get really comprehensive and coordinated care.
It sounds like it really takes a whole team to deal with the complexities of serious illness.
It does. That kind of collaborative approach is key to good palliative care.
So it seems like Medicarehub really gets it. They understand just how many different needs come up when someone's dealing with a serious illness.
Yeah, definitely. And it's not just about having the right people on the team. They're really committed to being accessible, especially their 24/7 support line. That really shows they understand the challenges, both emotional and practical, that patients and families go through.
Yeah, knowing you can get help anytime, day or night, that must be such a relief.
Oh, absolutely. Imagine, you're dealing with pain or anxiety in the middle of the night and you don't know who to turn to. Having that 24/7 support, it can make all the difference.
That makes sense. But I'm curious about the specifics. Like, what are some examples of how that actually plays out in their services?
Well, in addition to that 24/7 helpline, they offer practical help with things like daily living activities. That could be, anything from help with bathing and dressing to getting meals ready or some light housework.
So it's not just about managing symptoms. It's about helping people live their lives as normally and independently as possible.
Exactly. And we can't forget about the family members, the caregivers. They're so important. Medicarehub knows that they often need a lot of support too. So they offer respite care, which gives caregivers a chance to take a break, rest, and recharge.
Oh yeah, that's so important. Taking care of someone with a serious illness, it can be just like completely draining emotionally and physically. Respite care, it's like saying, hey, caregivers need care too, right?
It really is. And it can help prevent caregiver burnout, which in the end helps both the caregiver and the patient.
Right. It all comes back to that whole person approach that Medicarehub talks about. They're not just treating the illness, they're supporting the whole person in their network.
Yeah. It's about understanding that health and well-being, they're not just about one person. They're about families, communities, the whole web of connections.
Medicarehub seems to really get all this, but are there any potential downsides to this kind of intensely patient-centered approach?
That's a good question. I mean, patient autonomy is usually a good thing, but there can be some potential challenges. For example, some patients might feel overwhelmed by having to make so many decisions, especially when they're already dealing with a serious illness.
Yeah, that makes sense. And not everyone has a strong support system to help them figure all that out.
Exactly. So while Medicarehub's approach is great, it's important to be aware of those potential challenges and make sure that patients get enough support in the decision-making process.
So it's all about finding that balance, right, between empowering patients and making sure they have the guidance they need to make those choices.
Absolutely. And that's a conversation that's happening a lot in the field of palliative care right now. Providers are always trying to figure out the best way to balance autonomy and support.
It's a really interesting discussion. As we've been talking, it's made me realize that Medicarehub is kind of at the front of this big shift in healthcare. And it's like we're moving away from just medical treatments and towards a more holistic view of health and well-being.
It really is a big shift in thinking, and Medicarehub is definitely leading the way. They're showing that you can integrate palliative care into the existing healthcare system, and that can improve quality of life for patients and families, and it might even save the healthcare system money in the long run.
That's a really strong argument for making this model more widespread.
It is. And as we think about the future, it's important to think about how palliative care might change and evolve, especially with an aging population and more people living with chronic illnesses.
You're right. Those are big factors that will definitely shape this field. And it raises some important questions, like how do we make sure everyone who needs palliative care can get it?
Yeah, that's a crucial question. And how do we make sure these services adapt to the changing needs of patients and families? And can technology play a role in making these services more accessible and efficient?
It's definitely a challenge, but it's also a really exciting opportunity to build a healthcare system that puts well-being and quality of life first.
I agree. We need to make sure everyone, no matter what their illness is or what stage of life they're in, can access the support they need to live with dignity and comfort. It's a goal worth working towards.
Yeah, it is inspiring to think about how much positive change is possible. It feels like we're really at the start of a new era in healthcare, and palliative care is becoming more and more important.
It is, and organizations like Medicarehub are really showing everyone how it's done. They're proving that this kind of integrated, holistic care, it's not just possible, it's really effective.
One thing I keep thinking about with Medicarehub is their focus on families. It's like they really understand that serious illness, it doesn't just affect the patient, it affects everyone around them.
Absolutely. Family members and caregivers, they end up dealing with so much, emotionally, practically, even financially. Medicarehub really gets that, and that's why they offer so much guidance and counseling, and of course, respite care. It's a key part of what they do.
Yeah, it really highlights how important caregivers are in all this. Their well-being is completely tied to the patient's well-being.
It really is. Recognizing that connection is so important. It's about extending that circle of care outwards to include the whole support system.
It goes even further than just the immediate family, right? Medicarehub talks about working with other healthcare professionals, social services, community groups. It's like this whole network of support.
Exactly. Breaking down those walls between different services. It's a more integrated approach to healthcare where palliative care isn't just an afterthought. It's part of everything.
It's a pretty powerful vision. It makes me think think that this could really lead to better outcomes for anyone dealing with a serious illness.
I agree. And as we move forward, it's important to keep having these conversations. We need to raise awareness about palliative care and advocate for making it more available and accessible to everyone.
That's a great point. And to everyone listening, if you want to learn more about this, please do. Whether you're dealing with a serious illness yourself or you just want to understand this important part of healthcare better, there's a lot of information out there.
Yeah, the more we all know as individuals and as a society, the better prepared we'll be to handle these difficult situations. And we can push for a healthcare system that truly prioritizes holistic care and quality of life for everyone.
Well said. Well, that's all the time we have for today. Thanks for joining us for this deep dive into palliative care in the UK. We hope this is giving you a better understanding of this really important and constantly evolving field.
It was great to be here.
Until next time, everyone, take care.
We hope you enjoyed this podcast. Please visit our website to learn more about our services at medicarehub.co.uk. Bye for now.